Hi, I'm Dr. Matthew Norton, the founder of People Plus Purpose, and this is the Truth Behind Dentistry podcast. And today, my guest is Dr. Shervin Molayem. Dr. Molayem is a periodontist focusing on the oral systemic connection, who specializes in gum and implant surgeries, as well as research, particularly in dental technology. He established the mouth COVID connection, introducing innovations like an AI periodontal probe, which comes out this year, and filed a comprehensive patent for AI-driven dental treatment planning. Shervin is also the founder of the first traveling specialty dental group, Dental, and a board member of the largest dental staffing platform in the USA, Cloud Dentistry. Dr. Molayem co-founded the DAS Group, a dental venture capital fund dedicated to advancing dental technology and supporting early stage companies. He is actively involved in creating a dental accelerator with a mission to enable innovation in dentistry. He also hosts a podcast, Dental Innovation Lab, focusing on dental technology and the mouth-body connection. That's a lot of stuff. Welcome to the podcast, Shervin.
Thank you for having me, Matthew. It's great to be here.
Absolutely. I've been looking forward to the conversation. This is our first time officially meeting, but I've heard good things about you for a while, and we have mutual people in common. And all the way from Dental to your DAS group explorations now. So I'm excited for what you're doing, and
Yeah.
I'm glad to have you on and kind of have a conversation for a bit about some key topics. So I'm trusting that our listeners will be inspired by where we go with this. But you've been at the forefront of integrating artificial intelligence in dentistry, particularly with the development of the AI-driven periodontal probe. Can you share how this technology is changing the landscape of dental diagnostics and what this means for both the dentist and for patients?
Yeah. So really, in order to understand what AI is, because it's so broad, right? It could be used for calculations, it could be used for optics, visual, auditory. There's so many different things that can be plugged in and utilized for this. Or they could all be integrated together, right? So you can start to, have an AI that can, for example, be able to smell literally if there's disease in the mouth, look at the tongue, know exactly what's going on in the gut from the tongue. This is all, AI. So a couple of things. One, in as far as the periodontist, the technologies that I really get excited for are things that will standardize, make things that are precise, increase accuracy, and uh, really make things easier, especially for hygienists. The probe is exactly that. What it does is it's a technology that when you probe the gums, automatically it'll have the number put into the computer system at exactly this same pressure that's recorded in the literature that needs to be,
Mhm.
you know, sometimes there's too much pressure or too little pressure.
Right.
So that pressure is standardized, which is actually one of my contributions to the probe to standardize the
Yeah.
pressure.
Yeah.
Automatically detect the bleeding. So when there's blood that pops out, it has cameras, it can sense it and it put it into the system.
Okay.
Um, and then on the tail end, you have all of the calculations. You could find out before scaling and root planing, after the scaling and root planing, how much bleeding there was, how much improvement, what percent pocket reduction we have. This was a lot of these calculations were able to do, but it wasn't standardized. We didn't know if one hygienist and then a dentist was doing it after in one office, or if it was standard, if
Right.
right. So you
Right.
can't really make these judgments. Now we could. There's another company, for example, I'm not affiliated with, but they're able to take the mobility of a tooth. Right now we say it's plus one, plus two, or plus three.
Right.
That's all, very subjective, but they are able to go and give a number, a numerical value to the mobility now. That's, I think it's from like -9 to 50 or something.
Wow. Okay.
So now we're able to get a little bit more of a precise amount of the mobility of a tooth versus just a plus one, plus two, plus three ballpark.
That's great. And that's like my experience of that is mostly like post implant, but I guess probably any use of that, right? In terms of the
Yeah. So that will be for any during any exam, a standard dental exam. There, after you probe, you check the gum recession, the bleeding, and then you check the mobility.
or like
So
just to see how stable the tooth is.
every tooth
Yeah.
by the book, you have to go through every tooth. You usually take the back of the probe and the back of the mouth mirror, and you go on each tooth kind of quickly to see if there's mobility and movement. You can't use fingers. You can't kind of just touch it and move it. It has to be kind of two things. The patient's head has to be still because if they're moving their head, then it obviously looks like it's moving
Right, right,
or not moving.
right, right. So this is better. I mean, this AI based technology is better for from a clinical standpoint for the clinicians, but also better for the patients because of more accuracy, I suppose. Are there other ways that the patients also benefit?
Yeah, so it will reduce any exaggeration, any fraud.
Hmm.
Uh, if there is a 4 millimeter pocket versus a 5 or 6 millimeter pocket, there's a different treatment outcome,
Ah,
right?
okay.
So these are all really important. It's the difference between surgery and not doing surgery,
Hmm.
perhaps. So yeah, I think that's a huge benefit for society.
Yeah. So increases trust, I guess, there's reproducibility elements, and also because of some greater absolute finding, then the patients maybe better trust, whereas they've often not, I think, known when to trust what they're being recommended. Do I really need that versus something more conservative? And so, yeah, that all sounds really good.
Yeah,
Yeah.
exactly. Trust
Um,
is very good,
any
important
other
point.
things on the AI kind of element that you want to mention before we move on to a different topic? Anything that we didn't cover on that piece?
I think right now I'm working on some more. I'm developing my own AI right now, and it's in the category of more of like treatment planning, um, and it's it's going to be very comprehensive and be able to, really the goal is going to be to give what I say is our mission statement
Mhm.
or right? The mission statement has to solve and address a problem, right? The
Mhm.
problem is, in my opinion, the problem is that dentists have a similar stigma as like a mechanic in a certain extent that patients don't really know and understand what's going on in their mouth.
Mhm.
Similar, that we don't know what's going on under the engine,
Right, right.
and that creates a trust issue,
Yes,
right?
yes.
So by using AI, we want to be able to bring no doubt into dentistry and full, trust back.
And so the AI, in terms of being able, like from a diagnostic technology element, right, on the one hand, but also that's being translated then into treatment planning, into more accuracy, more
Yeah.
a more thorough
Yeah.
treatment plan, or how would you explain that?
A lot of the problem stems from the issue of subjectiveness over objectiveness. So right now we're practicing dentistry like 50 years ago, and it's very subjective, right? We have, we're our eyes that we're looking on. We're trained eyes, but
Hmm.
they're
Right,
eyes,
right, right.
right?
Yeah.
We have companies like Pearl
Mhm.
that are doing the 2D detection. We have Velmeni that are doing the 3D detection of radiographs. And so we have a company like Dently Tech that's doing the probing, a company like Parametrics that's doing the mobility, um, and more.
Mhm.
And those are all giving us numbers, actual objective numbers.
Mhm.
And I think that's the first step is in order to get out of that, you know, old school mentality of dentistry, the traditional way. I think it looks about, I think, it's a plus one, plus two,
Yeah, right.
you know, that can't be anymore. In this new day, a day and age, and we have the technology to have a number, or a numerical value for these types of um, parameters.
So in the AI treatment planning, is that it going to be able to integrate, or is the technology there that will take these different diagnostic tools with their unique contributions to the mix and integrate the information, this data into treatment planning? Is that
Yeah, that's the goal. Yeah.
okay? Yeah. And because I think I mean, obviously case acceptance has been a generally horrible proposition, right? So how many people are whether they say no directly or they just delay and never say no, but they never take action, right? That the follow through is poor. But why is that? So I think that the ability to generate data that the doctor feels more comfortable with in its accuracy, to be able to show and tell, certainly with some of the technology that's available, taking with intraoral cameras and all, but even with Pearl and things like that, everything that is able to help people see better, I think. But I mean, there's so many doctors who are not really good at ethically influencing people to move forward. And so they'll often soft pedal, not bring stuff. So they're under treating
Yeah.
to try to avoid patients thinking that they're over treating, right? Or being more assertive. So my hope is that somehow the mix of all of that comes together and people get what they actually need.
Yeah, exactly. Yeah. I have a good bird's eye view on what's going on because I'm also an advisor to a lot of these companies and an investor and see what's going on around, in this landscape. And uh, it's very exciting. There's also a lot of just, your average Joe companies that are just making things better,
Yeah.
right?
Yeah.
So, for example, there's like, a way to make overdentures more stable using magnets that are
Hmm.
lined up, very, perpendicular, and so the overdenture doesn't come off. You don't need as many implants. You don't need them to be straight either. You can have them angled. The AI will create an abutment that's comes out exactly perpendicular. It's a cylinder. So there's a lot AI is doing that we don't see yet, that are going to be affecting and just improving upon dentistry.
Uh, that seems like an exciting advent, the ability to do less implants and to be able to cover the gaps then better, I guess you're saying, with this type
Yeah.
of denture approach.
Yeah, so patients will benefit because things will be less expensive, things are going to be quicker and better.
That's great. Makes me want to live long enough to be able to
Yeah,
experience as many of these things as
yeah,
possible.
exactly.
It's great. Well, I'm fascinated by all these things, and I really appreciate all the work that's going in from creative minds, and obviously it does require venture capital and all of that. But I wanted, before we go into that, maybe just a little bit more, I want to talk a little bit about mouth-body connection because that's been a key. Um, Maybe we could talk a little bit about some of the emerging research in this area and what's the impact on health strategies and maybe how dentists are playing their part in the overall healthcare system.
Yeah, so, I mean, when you really think about it, it's only been maybe a couple of decades that we have gotten this information that the mouth is really connected to the body. Um, when I went to dental school, there was only one teacher that really mentioned it.
Hmm.
Um, and then when I went into my residency, a little bit more, but in the periodontal conferences, Back then, this was in, 2007, 2008, 2009 time range. There was some research coming out, but it wasn't like it didn't register. Didn't People weren't like talking about it to their patients.
Yes.
This shift happened this really this past decade, where now dentists are talking about it with their patients. People are seeing it on social media, that there is a 2 to 3 times higher chance of dying of heart attacks and strokes. This past year, for example, one of the conferences, the main at the American Academy of Periodontology, the main topic was rheumatoid arthritis and periodontal disease. And speaker after speaker just showing this evidence that's almost showing a causal to
Hmm.
that point.
Right. Yeah.
Can't use that word causal, but they're saying
Right.
it's
Right.
look at this.
Right.
The same thing that's happening here, the same proteins is making the immune system ripe for taking an advantage. And it's like it's causing this almost autoimmune and
Yeah.
rheumatoid arthritis.
Yeah.
Then you have cancer. The people who are getting cancer, when they look in their mouth, there's a tendency and a trend for it to be the more aggressive cancers, the pancreatic cancers, the lung cancers, the esophageal cancers, you know, colon cancers, which is linked to Fusobacteria nucleatum, um, which happens to be a commensal bacteria. So everyone has a little bit of that bacteria in them.
Hmm.
It's really the only one that is a commensal out of the periopathogens. But when it goes over a certain amount, it's linked to the heart disease and the cancer, especially the colon. So this is something that finally I think people are understanding. I've been seeing people come in because I still practice, and people are hearing about it and they're coming in specifically. I want to make sure my mouth is clean. I want to be healthier. I heard this and this.
Right. Right.
Well, it's really positive direction. Um, and really, I got into this originally uh, because especially when COVID happened, I was always into it, but when COVID
Right.
happened, I started doing more research on it, and realized really the first to come up with the mouth COVID connection.
Mm.
Uh, I published it in California Dental Association Journal in August of 2020, detailing out a hypothesis at that time
Hmm.
of why I thought people that have gum disease get a more severe COVID. So
Mm.
during the peak of the pandemic, when everyone was saying don't go to the dentist,
Right.
I was going on the news stations and publishing, telling people go to the dentist, actually, the opposite, because it turned out, it was a risky thing for me to do at the time.
Hmm.
But I don't shy away from risky things that
Right.
I think are right in the long run.
Right. Right.
Turned out that people that did have this gum disease, more periodontal disease shown on an X-ray, it later showed that in the plaque there of patients um, with COVID, they had this very severe, these periopathogens. Um, these people had like a 4 times higher chance of being put on a ventilator. Of the people being put on a ventilator, about at that time, it was about 80% of them were dying.
Yes.
So that's a pretty, big correlation right there in
Yeah.
association. So what was happening, what I was seeing, what really drove me to that conclusion was that there was a link between this bad inflammatory protein called interleukin 6 or IL-6.
Hmm.
And whenever a patient would be in a hospital and their IL-6 levels would go over a certain threshold,
Hmm.
they would be put on a ventilator.
Wow. Wow.
The title of the article was actually, IL-6 levels are a predictor for ventilation. I mean, this was like black and white.
Hmm.
Every time you go above this, you're on a ventilator. So why aren't we just focusing on this,
Right.
right?
Right. Yeah.
I was looking around. No one saw that. I'm like, am I the only one seeing this? It was pretty obvious. And people that have periodontal disease start with a higher level of IL-6. It's being secreted into the bloodstream locally. So it's priming their body and they're starting with higher inflammation.
Mhm.
So that was where that came from, the spark. And then later on, we published another article showing that actually the way that the COVID was getting into the body was through the gums and straight into the bloodstream through the gums. And that's where this is all about. This is a connection. What's the connection between the mouth and the body?
Yeah.
It's blood.
Yeah.
There's a lot of blood vessels, a lot of capillaries
Yes.
in in the gingiva, in the bone, the surrounding all of the teeth, uh, be from not only periodontal disease but also endodontic disease infections. But but endo is more something internally from a tooth coming into the bloodstream.
Right. Right.
Perio is anything from the outside slipping in and getting in, which could be bacteria in the form of bacteremia, sepsis, or indirectly through the cascade of uh, these bad inflammatory proteins, or what we call cytokines,
Hmm.
getting secreted, and
Yeah.
that's basically just a downstream of wrecking in the body. And it creates a higher burden of inflammation for all these other chronic diseases. And that's why periodontal disease is linked to over 50 chronic diseases.
Wow. Well, this is kind of long time in the coming, right? These understandings. I mean, and people have understood that like putting something under the tongue as a way of getting it into the body. Uh, but I think most people probably haven't thought as much about, the gums and, other tissues that are not under the tongue, but it shouldn't be too foreign for people to embrace that, I wouldn't think. But I just think everything, dentistry has been unfortunately very siloed. I'm sure we could go back and look at the history of how it got like that, or as though somehow the mouth, but because people think teeth are in like not living substances or something. I don't know, but as though it's an isolated healthcare profession that's
Yeah,
not connected to the rest of healthcare. It makes no logical sense once you really look at it, but it's not been helpful for so many people. I'm curious about, given the greater understanding now of these things, how you feel about the progress of moving from conceptual understanding, research verification, to the ability for the ease now for enough individual doctors in their practices to track and diagnose, track these processes, and then where we are in terms of agreement and organization of treatment plans for dealing with these abnormal microbiome situations.
yes, yeah,
I'm not sure. Have we integrated that enough yet? Are people still off all out here, or what would you say?
yeah. So I'm in the middle of publishing a protocol that I'm coming up with. And it'll be released in I want to release it February 19th at a meeting.
Okay.
Basically, it is a new way to collect data for periodontal disease. Okay. And it consists of a few steps, right? So you have the patient in, whether it's their first time, for consultation, new patient, or a follow-up, where you first need to do the probing depths using the Dently Tech a probe. Okay. And then you have so all of that data gets input. Then you have the next step, which is the probing depths, the bleeding. Then you could also get the saliva test, okay, which is a spit sent to a lab and tell you what kind of bacteria are in the mouth. So now you know who your enemies are, right? If you don't know who your enemies are, how could you conquer them?
Mm-hmm. Right.
Some need a certain antibiotics, some spread throughout the body, some need multiple antibiotics even afterwards.
Right.
Um, some are transmitted to kids, and you have to talk to them about helping out, bringing in their kids so they can catch it at a younger time for their kids,
Yes.
whatever.
Yes.
The next step is a microscope, okay, which I have now, and I'm able to take right there with the patient on right chair side, a swab, put it onto this to the slide, pull it up on a screen, and they can see exactly, you could identify what kind of microorganisms are there. Usually we'll see how active it is too, depending on the movement. So sometimes you see it moving a lot. It's
Mm-hmm.
more active periodontal disease. Sometimes it's not as active. You won't see it as moving as much. Sometimes you'll see some parasites even, which is another thing that's linked. There's a kind of a connection between the parasites and the periodontal disease, but that's not really mainstream quite yet. And then there's a new device that we're going to be bringing out to the United States that really nobody has gotten to. Will probably be this will be the first time people will be hearing about,
Mm.
which is a camera, a light that's being shined right in the mouth. It has an immunofluorescence that connects at a certain frequency of light as the biofilm of the bacteria. So anything that has this harmful biofilm will glow in a neon color.
Mm.
So with this, you can detect not only gum disease, tartar, but also you can see some cavities. So this is another tool now, in addition to X-rays, X-ray detection of AI,
Mm.
um, this X-ray detection of CT scans, all the things that we talked about
Yes.
into the mix now.
Yeah.
The patient, when they look and they smile, they can't see any of this.
Right.
When they look in the camera, everything is highlighted, as if you put a highlighter where all their tartar is, where all their cavities are. And not only does it, help the doctor see, but it actually is a tool to motivate
Yes.
really
Yes.
the patient, because usually they have, with this in the mouth. If people don't look in their mouth really too much,
Right. Right.
it's just I found, I'll ask people questions about their mouth, and people really don't know too much,
Right.
um, unless it hurts, then they know it's there,
Right.
right? Well, you have gum recession. Yeah, someone told me, I forgot where the gum recession. People
Right.
really don't look. Um, but with this, it's like okay, there it is.
Yes.
So that's going to be the flow really of the probing, check mobility, recession, saliva test, microscope, this camera light. And after that, as far as gum disease, it will be a full, flow from beginning to end of them really understanding what's going on. Of course, you have to, show their X-rays where their bone loss is, and what,
Right.
X-rays is
Right.
a bit, but chair side, this is also going to be huge.
And then leading into some clear recommendations, right? Not only to deal, I mean, to deal with all of those things, because some of it is, whether it's cavities that already exist, or, I mean, some of those things that are people are used to having treated, but many things in terms of their microbial problems, I mean, nobody's been discussing that so much, or the answers for that. And I guess that kind of just leads me to say that I think, my own personal experience through my life overall in dentistry is that there failed to be very comprehensive understandings or solutions offered, that it tended to be very reactive patch and repair, short-sighted. And that's part of what makes me excited about more comprehensive understandings and more comprehensive either better self-care recommendations or just this is what we need to do that you would never know how to do for self-care. Like you don't
Yeah,
like like you don't have a plan for that. You can't even do that from home or
yeah,
unless we give you something specific for it. So for people I think who've had chronic issues or kind of dental fatigue, dental frustration, like what now? I can picture a whole lot of people who are no longer kids or even young adults going, I like all these things have taken a toll on them. And now what? Like to have somebody to have a doctor they can see to where they feel like somebody has a comprehensive understanding, and this is what we still can yet do for this person and their mouth to hopefully ward off bigger consequences of disease, fatality threatening diseases, right? That started there, but they don't know what else to do, right? So
yeah,
I guess that's just sharing some of my enthusiasm,
yeah,
possibilities.
yeah. When I look at the difference between, again, maybe this decade and the previous decade, there is a big, you know, push for longevity and wellness
Mhm.
that I hadn't seen before.
Right.
Uh, People talking about wanting to live longer, wanting to
Yes.
live healthier longer, like a
Yes.
long health span,
Yes.
um, taking more vitamins, doing those things that really you don't even need your doctor to tell you. Now you're just it's all around you.
Yes.
And one of the biggest, I think, pushes towards these is our social circles. When you see your friend lost weight, when you see your community, someone doing something good, posting about it, you see the results, you see those types of things, social proofing on many of these things. But there is a conference coming up actually this weekend that I'm going to be going to, and it's called the Don't Die Conference.
Don't die
Don't
conference.
die.
Who's involved with that?
It was Brian Johnson. So he's
Brian Johnson. I just
yeah,
listened to a podcast interview of
yeah, yeah. So he's having a conference, for example, and he spends several million dollars
just
a year.
listened to this last night. It's
Yeah, yeah,
we had this conversation.
yeah. So yeah, on Saturday he has a conference
Wow.
in Los Angeles, and it's basically he's tests different things on his body. He spends a few million dollars a year, sponsored by this and that, and he has his own vitamins now that he has, um, and again, these conferences are he's not the only one. There's Dave Asprey, there's Mark Hyman,
Mhm.
there's which I'm sure you've heard of.
Yes. Yeah.
There's the concept of functional medicine,
Mhm.
uh, which actually um, I, I learned about functional medicine myself, maybe 2019. Um, when I had learned about it, I would talk to people about it, and nobody would know about what it was. So
Yes.
functional medicine.
Yes.
What is it? Um, if you looked up functional medicine in Wikipedia, they would say that this is, quackery.
Hmm. Yeah.
This is, BS. This is, so it's one of those things that now a lot of it has been proven to be true, right? It makes sense, right? You're not only using medicine, you're also using some supplements, some vitamins, some plant-based, you
Right.
know,
Right.
supplements to, um, you know, and to help people out. But you're also looking at a lot of different things, right? So there is uh, your community, not being lonely,
Right.
right?
Right. Right. Yeah.
To be that the studies of the happiest people in the world, that live the longest,
Yes.
they have this community,
Yes.
friends, of playing on a team, playing cards with people
Right.
in their 80s,
Right.
90s.
Right. Yeah.
Stress, walking, movement. One of the main things in functional medicine is the gut, is is the food you eat,
Yes.
right? Keeping a low sugar diet.
Hmm.
The sugar is the enemy here. Um, and it ages you on all of these things. Antibiotics, overuse of it, overuse of ibuprofen, overuse of Tylenol. People have aches. They all they do is they take every day an
Yeah.
ibuprofen, an aspirin, even aspirin daily.
Yes. Yeah.
They take it for the doctor told them to take aspirin daily. If you take fish oil, like a good fish oil, a good amount of it, which is more of a natural supplement, it does a similar effect to aspirin, pretty much. And I know that, and I see that when I'm doing surgery on a
Mm.
patient. Sometimes I'll just be like, "Are you taking fish oil or something?" Like, "Yeah, I take fish oil," and you can see the blood is just it's much more thin because it's an anti-inflammatory and it has some thinning properties. So so you have all of these different things that really affect,
Hmm.
and it's not just one, right? And in Western medicine, we're looking at just one avenue.
Yes.
The hospital foods when they're in the
Yeah.
hospital. Look at the doctors. Do they
Yeah.
learn about any nutrition in
No.
school? I
Yeah.
think less than a day's worth.
Right.
I
Yeah.
think I remember maybe it was 8 hours of nutrition. And things are changing. People
Yeah.
are starting to learn that uh, turmeric is good, curcumin. That for example, for diabetes, there's a supplement that's called berberine, berberine. The studies show if you take it once a day, it's plant-based. If you take it once a day, after 3 months, you could lower the A1C from like 8.3% to 7.4%, almost one whole number down.
Yes.
And that it's equivalent to metformin. So, you know, and I always ask the patients, talk to your doctor, tell them don't, I can't literally tell them to take this because if they're
Right.
taking other medications, I don't
Right.
want it to mix with it.
Right.
But I tell them like, don't be surprised if your doctor doesn't know about this.
Yes. And that's where the hope would be for more, more interaction within various would have been siloed areas of expertise, right? And for the patient's benefit, that there's more conversation going on that's open and receptive. And yeah, the whole functional medicine thing, it's like really, it's like it's kind of no brainer that all of that makes perfect sense. But why has that not?
Yeah.
Yeah, I think we could propose why people are making
Yeah,
money.
I think we all know why.
Yeah.
We're get you know what it's the functional medicine is getting to the root cause.
Yes. Yes.
And if you do is you get to the root cause, if you get it to it, upstream, then all the problems that are having downstream, as you know, there's
Yes.
no
Yes. Less
solutions for. But
crisis,
yeah, I took a
reward. Yeah.
exactly. I took a so during that time in 2020, I took the whole, about half of the functional medicine courses at the Institute for Functional Medicine. That's how I got involved in this. There was because at that time it was, COVID and you could do it online and
Right.
there was people from all over the world. I think it was like hundreds of people
Yeah.
that took the course with me.
That's great.
Yeah, yeah, there was maybe a couple of us dentists
Yeah.
at the time.
Yeah.
So it's nice to know that there are some dentists that are know about this.
Yeah. Progress is progress.
Yeah.
And so this has been a wonderful conversation. I feel like we touched on only a portion of what we could talk about and what we should talk about. So I think we should do a part two sometime soon. Um, and I already went way past. I know this is what we normally do. This is not a Joe Rogan podcast, probably where people will always are used to listening for 3 hours like Joe. But I'm trusting that our listeners have been inspired by this and learned some new stuff. I feel like there were some definitely new things that were shared, and I thank you for that. I appreciate all that you're doing. and look forward to being of whatever support I can be moving forward, and excited to see where all this goes. So I
Thank you
really
so
appreciate
much,
your time
Matthew. Thanks
today.
for having me. Thanks for doing this, what you do. You're really, you know, doing what your podcast says, and it's, bringing the truth behind dentistry to the masses. So thank you.
Well, thank you. Yeah. Well, so everybody, this has been Dr. Shervin Molayem, and I just thank you for your time and attention. I hope you've subscribed. Please tell others, bring your friends. Let's keep doing this. Let's keep shining the light on the truth behind dentistry and see if we can help everybody get healthier. So look forward to seeing you next time. Thank you.